Hey everyone, my name is Ilion,
And my name is Shoaib.
and our presentation is on Machismo's impact on sexual health education for Latina immigrant mothers and their daughters. So, the Latino community is one of the largest minority groups in the United States. However, they've been disproportionately impacted by negative sexual health outcomes compared to other ethnic minorities in the US, as they've been experiencing very high rates of sexually transmitted diseases, unintended pregnancies, and teen pregnancies. And from our research, we found that the two main causes of this are cultural stigma and structural barriers. When talking about cultural stigma, the two things that immediately come to mind are the terms machismo and marianismo, which describe the traditional gender roles within the Latino culture. Machismo is a gender role defined by masculine and dominant characteristics, which give men control and authority within their sexual relationships and allows them to do things such as make decisions over condom use and other forms of contraception. On the other hand, Marianismo is a gender role concept in which women are valued for their feminine characteristics, submissiveness, and motherly qualities. So together, machismo and Amerianismo have created this cultural history that has been limiting communication of sexual history between partners and making sex shameful for women. The other thing that comes to mind is vergüenza, which is defined as shame with regards to sex or sexuality. Um, these terms of vergüenza, machismo, and marianismo um, have perpetuated the cultural stigma around sex and promote poor sexual health education. And this is seen in these negative sexual health outcomes. Some other outcomes are discomfort in discussing sex or STDs with parents, partners, or doctors, pressures on teenage girls to practice abstinence, male disapproval of women visiting other male practitioners, or improper or lack of use of birth control. On the other thing that's been influencing these poor sexual health outcomes are structural barriers, and these include perceived racism, language barriers, lack of health insurance, and providers' assumptions about Latina women's sexual behavior, and all these have contributed to a reduction in future healthcare seeking behaviors.
With regards to interventions, one of the primary ways of addressing poor sexual health education and access to sexual health care is to devise interventions that encompass the relationship with sexual health that younger and older generations of Latina adolescents and women hold. These interventions must prioritize sexual health needs for immigrant Latina women while considering the factors that contribute to the sexual health disparities of Latina women, such as cultural stigma, machismo, marianismo, and the barriers at the institutional, structural, and environmental level. Some of these sexual health needs and priorities that have been named via community-based participatory research studies include clarifying misconceptions about reproductive anatomy, negotiating condom use or proper use of contraceptives, and building skills for women to effectively communicate with doctors, their partners, or their daughters. Through gender inclusive and culturally aware sexual health education curricula, interventions can focus on four primary objectives: increasing access to sexual health education, decreasing disparities in sexual and reproductive health, building confidence and reclaiming space and sexuality regarding cultural stigmas and issues of machismo and marianismo, and lastly, building skills in effective and open communication between mothers and daughters. Programs would be facilitated by promotoras who are previous graduates of such programs working as community health workers to ensure a safe and familiar environment while helping to identify the barriers that the community is facing. And so to the right of this poster, we can see a proposed 15-week program that works with mothers and daughters to achieve the sexual health priorities they have through various skill building and discussion-based programs that are facilitated in a safe and judgment-free environment. In carrying out such interventions, the program aims to reduce the intergenerational stigma of sexual health, as well as the negative sexual health outcomes that come as a result of it.